Thank you for taking a few minutes to learn about gap insurance. As you know, health insurance premiums have been on the rise for a number of years. Employers are always looking for a solution. The question is, how do you respond? The first way is to trench down and hope for the best. I call this the ostrich in the sand approach. The broker doesn't really know what to do, so he just puts his head in the sand. The second is a cost-shifting game, moving deductibles and out-of-pocket costs and premium contributions around in an effort to solve the problem. Or think outside the box. Use a different strategy to help your employer and their employees. You're probably already doing a few of these, but some examples are HSAs, HRAs, self-funding, worksite. This strategy that we're going to be talking about is gap insurance. It's another strategy, and I think you'll find it very useful. The concept is really simple. You move your group to a high deductible plan, maybe a $3,500 or a $5,000 plan, and then you backfill that deductible with gap insurance, first dollar gap insurance. That's very significant because the average employee can't afford their $1,000 deductible that they have, much less a $5,000 deductible. Its statistics say 50% of Americans make less than $25,000 a year. So anytime you give employees first dollar coverage, you're significantly enhancing their benefits. Again, the concept is that these two plans together cost less than the current plan. On average, we save groups about $1,000 an employee per year. So how does it work? Well, here's a picture of our ID card. We use a two-card system, so one for the major medical and then another card for the gap plan. The provider files major medical primary, and then once the EOB is returned, they file our plan secondary. We then pay the claim immediately. What's great about our plan is that if a covered claim is approved by the major medical but is subject to the new high deductible, the bill is paid by the gap plan. The provider is paid directly. What really separates us from a lot of our competition is that we look at the EOB, and if there's an out-of-pocket expense on the EOB, we pay it. We pay for all sorts of things. Surgery in a physician's office, durable medical equipment, surgery in a hospital, MRIs, x-rays, emergency room, you name it. When it's on that EOB, we pay it, and that helps set us apart. This is an actual copy of an EOB that an employee received not too long ago. This is what employees get really excited about. When is the last time an employee received an EOB in the mail that said amount you owe to provider $0? This was a $500 claim, as you can see in the bottom left-hand corner. The provider discounted it, but the total bill still owed was $330. Well, as you can see in the bottom right, we paid that hospital $330 on behalf of the employee. So their portion that they owe is $0. This is when you start to have employees high-fiving each other in the hallways and talking about how great their benefit plan is. Again, as the broker, you now look like the hero. The plan design is pretty simple. Each employee receives two separate buckets of money. So the first bucket is inpatient expenses, anything that happens in the hospital. The second bucket is outpatient expenses, so anything that happens outside of the hospital. The outpatient benefit is capped, however, so it cannot be more than 70% of whatever your inpatient amount is. So if you have an inpatient benefit that's $5,000, the max outpatient benefit you could get would be $3,500. Here's a quick case design. On the left, you can see that this group had a $1,500 deductible plan, 80/20 to $3,500. So they had their co-pays, and then for anything in the office, you'd have to pay deductible co-insurance. Then you had all your in-hospital and out-of-hospital MRIs, they had deductible co-insurance. On the right, we've designed this plan to have a gap plan in place, so they get to keep their co-pays, but if they have an x-ray or blood test while they're in the doctor, we'll pay it for them. Same goes down here. They would normally be subject to their deductible and co-insurance, but our gap plan is going to pay first. Outpatient, MRIs, hospitals, the gap plan pays first. That's a significant advantage, and in my opinion, the plan on the right is probably a superior plan to the plan on the left because of the first dollar coverage. This is probably the most exciting piece, however, for the employer. This shows the rates. So you can see that this group had a $390 rate And when they renewed, that rate jumped up to $448, almost $450. So they were obviously looking for a solution. We came in and told them that they should move to the $5,000 deductible plan. The $5,000 plan is only $331, as you can see. But then they had a significant gap in their out-of-pocket costs from $1,500 to $5,000. So we came in and put our gap plan in place for $80 a month, and now the medical plus the gap is $411. So we saved them on average $40 an employee, which actually came out to about $48,000, almost $50,000 a year that we saved this group. And that goes back to the example I talked about earlier. On average, we save groups about $1,000 annually per employee. And this is a great example of that. Now you may be asking yourself, well, what happens in 2014 when they do away with a lot of these $5,000 deductibles for these smaller groups? Well, I'm glad you asked, because we plan on taking these bronze plans and gapping them and creating a titanium plan. Bronze plus gap equals titanium. So you just switch to the cheapest plan available within the 60% rule, you add a first dollar gap plan, and boom, now you have a plan that's richer than even a platinum plan. We can also use these gap plans to gap these self-funded products. So a lot of times you'll have one of these max funded products that looks and smells like a fully insured, and those can have higher deductibles as long as they stay within that 60% rule. I think we're going to see a lot more of these, and if you'll stay on the lookout, we will be releasing our self-funded plan within the next few months. Thanks for taking part in this quick presentation. I hope you've learned something, and please contact me for additional information or proposals. We look forward to working together. Thanks.